Clapperboard £16.3 million boost for Oxford Health, what it means for you. One present situation, today's snapshot. Good afternoon. It's Sunday, May 7th, 2026, and the £16.3 million that flew into Oxford Health's coffers last autumn is already sparking change across Oxfordshire. The partnership, a joint effort between Oxford Health NHS Foundation Trust, the University of Oxford, and local councils, has opened 3 community hubs in Oxford, Banbury, and Kidlington. These hubs run free health checks, digital well-being apps, and smoking cessation workshops. Over 7,000 residents have signed up to the first round of programs, and the partnership is now rolling out a longitudinal study to track long-term health outcomes. So, what does £16.3 million look like on the ground? It's a tangible boost that's turning policy into action. 2 recent developments, the award that sparked it all. The story began on October 16, 2025 when NHS England announced the £16.3 million award to the Oxford Health Partnership. That day, the Trust's chief executive, Dr. Sarah Johnson, spoke at a press conference in Oxford's historic Guildhall, outlining a 5-year plan to cut hospital admissions by 12% through preventive care. The partnership's brief was clear: fund community-based interventions, harness data analytics, and embed mental health support into primary care. Since the announcement, the partnership has secured an additional £2.5 million from the Department of Health and Social Care, ensuring that the initial grant can be stretched further across the county. The momentum built in October is now translating into concrete programs that started in early 2026. 3 current impact, early results for the community. The first 6 months of implementation already show promising metrics. The partnership's data-driven dashboard reports a 7% drop in emergency department visits in the Oxford Hub, a figure that mirrors national NHS data showing community health initiatives can reduce admissions by up to 10%. In Banbury, the digital well-being app has logged 3,200 active users, with a 25% reduction in reported anxiety scores after 3 months of guided mindfulness sessions. The smoking cessation program has helped 1,200 participants quit, a 15% increase over the previous year's quit rate. These numbers illustrate how the £16.3 million is not just financial support but a catalyst for measurable health gains. For stakeholder voices, what partners are saying. Dr. Thomas Reid, head of public health at Oxford Health NHS Foundation Trust, said, "We're seeing real, tangible change in our patients' lives. The funding allows us to deploy evidence-based interventions that were previously out of reach." Local councillor Aisha Khan added, "The partnership has brought the community together, fostering a sense of shared responsibility for health." The University of Oxford School of Public Health is also collaborating, using the grant to fund a research project on the social determinants of health in rural Oxfordshire. These voices underscore that the partnership is a collaborative, community-led effort, not a top-down initiative. 5 Financial context, where £16.3 million stands in the budget. To put the £16.3 million into perspective, Oxford Health NHS Foundation Trust's annual operating budget is approximately £420 million. Therefore, the partnership's award represents roughly 3.9% of the Trust's yearly spend. For Oxfordshire, the grant is the largest single public health investment in the past decade, surpassing the £12 million fund allocated in 2024. This infusion is expected to unlock an additional £5 million in private and recorded funding through the partnership's cost-saving initiatives, such as reduced inpatient stays, which could recoup the investment within 5 years. The financial ripple is significant for a county that serves over 420,000 residents.